The last few days, there has been a lot of discussion going on. The statement made by Dr. Kamakodi, the director of IIT Madras, on the efficacy of cow urine, fresh cow urine, for suppressing or curing some kind of fever and irritable bowel syndrome and many other diseases. That's a statement he has made. This has been subsequently supported by Dr. Tamilisai also. These two statements coming one after another has drawn considerable comments. Some people for it and some people against it. I do not want to go into the political wrangles clouding the truth behind the statement. I am a scientist and I want to stick to that one exactly. I do not want to overstep on this point even a little. When many hackles were raised against the statements of these two very respectable people, Dr. Kamakoti as well as Dr. Tamilisai both said that there has been significant research publications on these points confirming the efficacy of cow's urine as an antibacterial, antifungal agent. And they have cited many research papers, a pattern, and yes, not that I value these two respectable people less, but I value science more. I went through all the research papers and patterns that they have cited. Please note, all these are in vitro studies. That is, they have taken certain kind of bacteria, fungi on a petri dish, added urine extract, cow urine extract directly or some kind of pellet or whatever it is, and they have found out that it is really killing bacteria and fungus. This is correct. I accept, and we know this very well. Not only that, cow's urine is a good organic insecticide. It's all very well proved. But remember, these are far away removed from the fact of admitting or allowing the people to drink for certain disease. The first one is a in vitro study, very, very preliminary study. In that respect, the phenyl or the Dettol that you use for your cleaning your hand, all of them are antibacterial, antifungus. But none of us would ever dare to drink or a sip Dettol or phenol. This is where they have overstepped their claim on the efficacy of cow urine in curing diseases. There has been no study at all anywhere in the world that has been published a kind of randomized control study. What is this randomized control? Just to see what is I'm showing it. It's randomized control study done in different places, and then only that kind of medicine will become to the use of common people. I can give an example. You are all familiar with metformin and paracetamol. These are common medicines. Particularly metformin is easily administered by all the physicians all over the world for diabetes, and India is a very good country for diabetes. This metformin has gone through so many processes of testing and counter testing, so many sets of valuation, and finally it will be proved only by randomized controlled study. What is that? You must ask some professional doctors, they would tell you. And then such a study has not been done anywhere in any part of the world for this particular cow's urine. On the other hand, it has been a convention, and some people has believed the old stories of some traditional medicine. For example, in Nigeria, they have administered this cow urine for a set of dogs, and they have found that these set of dogs have enormous problem, and they have many, some of the dogs have died also. All this because in Nigeria there is a superstition, stupid superstition, that cow's urine will cure epilepsy, and many people have administered this one for young children and they have lost the children. This shows how dangerous is it to play with the untested medicine. Remember, untested medicine. Another example point is, have you ever seen this cow's urine being prescribed in any of the hospitals in India, any of the hospitals in Chennai, government hospital or Apollo hospitals or Zipmer or All India Institute of Medical Sciences Delhi? No, none of them will ever dare to prescribe them because such a test has not been done. Whoever is prescribing this medicine, they would be the degree will be seized back. This is true. Now, with all this one, we should not dare to treat too much based on a kind of superstition. I want to end my talk with 3 important couplets from very famous Tirukkural. First one is, எப்பொருள் யார் யார் வாய் கேட்பினும் அப்பொருள் மெய்ப்பொருள் காண்பது அரிது. எப்பொருள், அடுத்தாப்புல கவனிங்க, எப்பொருள் எத்தன்மை தாயினும் அப்பொருள் மெய்ப்பொருள் காண்பது அறிவு. இது ரொம்ப ஸ்ட்ராங்கான திருக்குறள். அதை விட ஒரு ஸ்ட்ராங்கான திருக்குறள் அங்கே தான் டாக்டர் காமகோடி அவர்களும் டாக்டர் தமிழிசையும் தவறு செய்து விட்டார்கள். என்னவென்றால், கல்லாத மேற்கொண்டு ஒழுகல் கசடு அற வல்லதூம் ஐயம் தரும். கல்லாத மேற்கொண்டு ஒழுகல் கசடு அற வல்லதூம் ஐயம் தரும். What is the importance of all these Tirukkural? I want somebody to explain to these 2 respected people. And please note, I have high regards for them. I have come all the way to bring out the scientific validity of this particular issue. I have nothing against or for them. I have only great regards for both of them.